Imagine getting up every day full of energy as if you were in your 20s again. What would that be like? What would it be worth to you? What is your health worth to you? Think about it. Your health isn't everything, but without it, everything else is nothing. And yet, too many of us are taking it for granted until something goes wrong. And no one wakes up hoping to be diagnosed with a disease or chronic illness. And yet, we've never been taught how to be proactive in our health through our school or public health. As a registered health coach and integrative health practitioner, I believe it's time this information is made available to everyone. Combining new knowledge around your health and the ability to do my functional medicine lab tests in the comfort of your own home will allow you to optimize your health for today and all your tomorrows. Don't wait for your wake-up call.
Welcome back to another episode of the Don't Wait for Your Wake Up Call podcast. I am Melissa Deely, and today I have here with me as a special Podapalooza guest, Helene Bertrand. Welcome to the show, Helene.
Well, thank you for welcoming me, Melissa.
Well, I'm excited to have this conversation with you and just want to introduce you to the audience. In the last 12 of her 55-year medical practice, Dr. Helene Bertrand concentrated on treating painful conditions. She developed a mannitol-containing cream able to calm the nerves that send pain and itch messages to the brain. QR cream. She found new solutions to many painful conditions, including low back pain. Her newest book addresses that pain with a simple 2-minute exercise anyone can do to solve their low back pain without surgery or medication. I love that. So, Helene, please share, how did you come to decide that this is what you wanted to do at the end of your medical career, and share your story of how you got to where you're at today?
Okay, well, I graduated from medical school in 1965, so long before everybody else was born. Anyway, at that time, a year later, I had my first child. And my first pregnancy caused me to start having low back pain. And I had low back pain for 37 years.
Wow.
And believe me, I mean, I'm a doctor. I know the side effects of medications. There's no way I was going to poison myself with that stuff. But I had sometimes pain so bad I couldn't even get out of bed. And did you know that the International Association for the Study of Pain says that 90% of all low back pain is non-specific, which means we don't know what it is. And if you don't know the cause, the treatment is not treating the cause.
Exactly.
It's here, there, and everywhere. And so I tried all the treatments here, there, and everywhere. The physiotherapy and the chiropractic manipulations and the acupuncture and the massages and the hypnosis and the you name it. I tried it for 37 years. Until I finally discovered the cause of low back pain. And it's very simple. Do you know why 80% of all human beings have low back pain? Like almost everybody?
In my line of work, I would say it's unresolved negative emotion carried in the body.
Well, I'll tell you a physical reason, a physics reason, is that unlike all the other animals on Earth, whose body is horizontal, our body is vertical.
Upright. Yes.
And so the weight of our body isn't carried by our spine. What do you think is carrying it?
Our feet? I don't know.
You've got two big bones here.
The hips.
No, those are not your hip joints. Those are your pelvic bones.
Okay.
And those two big bones are carrying the whole weight of the upper body.
Mm-hmm.
And that weight is pushing them away from the sacrum, that little triangular bone where they attach. And you can actually, if you put your hands here, you'll feel those two bones.
Yeah.
If you feel in the back, you'll feel two bumps. Feel the two bumps.
Mm-hmm.
That's where the tops of your pelvic bones end, and that's where they attach on the sacrum.
Right.
Those are the sacroiliac joints. And once you know that, then if one of those fingers, because your fingers should be level, if one of them is too high, then you know that it's tilted forward. If it's lower than the other, it's tilted backwards. So if it's tilted forward, you're going to use your thigh to push it back.
Mm-hmm.
So you flex your thigh against that bone. And if it's tilted backwards, you're going to extend your thigh to pull it forward. And by doing that, you're going, and if you, those joints are invisible, and that's why the pain is called non-specific, right? Because your hip joints are inside your pelvic bones.
Right.
And every time your foot hits the ground, that joint it's jolted.
Right.
And so that joint, instead of being smooth like every other joint in the body, is full of bumps and hollows because it's absorbing the shock of every step you take. And because it's so irregular, that joint can't be assessed with medical imaging. You need your fingers to find out about it. And guess what? Most doctors nowadays don't use their fingers to examine their patients.
Yes.
And if you don't use your fingers,
you can't find it.
Know. You won't know in what direction the joint is displaced. And if you try to replace it without knowing in what direction, you could be making yourself worse.
Worse, yes.
So that's how I discovered it. And then I tested it on 180 consecutive low back pain patients who came to me for low back pain.
Right.
But I hadn't examined them. So, 78% of them were immediately relieved of their pain after that 2-minute exercise. So at least 78% of all low back pain comes from these displaced pelvic bones that doctors who don't examine their patients don't know about. And that's why I wrote the book.
And the book is called Low Back Pain. Easy. 3 simple steps. 3 steps to relief in 2 minutes.
That's right.
And so this is something that people can use on an ongoing basis as needed?
As needed. As much as they need. But there are many, many, many other ways to relieve the pain, to prevent it from happening and all that stuff. And the book tells you all about that. Because, for instance, you're sitting on your pelvic bones right now. It's called the sits bones. Well, if you get low back pain from sitting too long, then you need to keep those sits bones together. And there's a cheap seat cushion that you can blow up called a donut that will hold the sits bones inside the center of the donut. And then the low back pain doesn't happen. So, if you're lifting heavy objects, then you need something to hold the pelvic bones together, because the more weight there is, the more these bones are pushed away from the sacrum. So you buy yourself a pelvic support belt. All these things and if you want to fix it forever, for good, is you use something called prolotherapy, which rebuilds the ligaments that hold the joints together. I mean, there's so many ways that you can. Anyway, I talk too much.
And without needing surgery, which is nice because so many people are just given the option of surgery, and then the recovery from surgery can also be very difficult on the body and take a long time.
Oh, not only that, but 40% of those who take the surgery still have pain after. And I actually have pictures of people who've had their whole lumbar spine fused and who still had pain because there was a distance in between the levels of the two sacroiliac bones. So before you get the surgery, for heaven's sake, check your pelvic bones.
Yes, because otherwise you're fusing it into a position that is causing you pain as opposed to a position that helps.
And the thing is that if you fuse the lumbar spine, that shock absorber thing is going to be worse because the lumbar spine, and so it's going to make your whole spine worse.
Right.
So, yeah, you have to be careful what you do.
So you had back pain for 37 years yourself.
Yes.
And then you discovered this for yourself and used these steps in order to heal your back pain so you no longer suffer from low back pain?
I have none at all.
Beautiful. So kind of the opposite to most people who have the back pain in their later years. You had it in your early years, and now in your later years you are moving beautifully with no back pain.
I walk 10,000 steps or more every single day up and down steep hills.
Good for you. That's awesome. I love that. And I love how you explained it. It makes it so much sense and easy to understand, and also easy to understand why during pregnancy, that's a time where a woman's body is changing and adding weight, and it's happening fairly rapidly, right? In a 9-month period, and how that tilt in one way or the other can happen.
Well, the other thing is that you've got this great big weight that's pushing your pelvic bones.
Yes.
And you've got a hormone called relaxin. And that hormone relaxes the ligaments that are holding your pelvic bones together so that the baby's head can go through your pelvis.
Right.
So
a lot going on there that makes sense that, women can have low back pain during their pregnancy.
Of course.
And I did myself, and
you know what it's like then.
Exactly, not to the degree that you did. However, I totally understand that, that is a common cause of low back pain, and I'm so glad that, you figured it out for yourself and healed yourself, and now you're helping others heal. And then you also mentioned that you have a cream that you have developed.
Well, I was injecting around people's nerves with something called mannitol. Mannitol is a sugar alcohol. It's essentially it's a dextrose molecule, so it's got 6 atoms of carbon, and then it has 1 OH added to it. So it's a sugar alcohol. And every plant and every mushroom has mannitol because it kills bacteria. It's a sugar alcohol, and it's an antioxidant. And whereas dextrose itself is an oxidant, this is antioxidant.
Right.
So it's good for your body.
Yes, it's helping clear out some of the toxins.
And so I was injecting around people's nerves, and because the pain relief was so quick and so complete, doctors and pharmacists would come and look at what I was doing. And this pharmacist was observing me, and she said, I've never seen pain go away so fast and so completely. And she said, but people don't like injections. Why don't we make it into a cream? I said, sure, let's make it into a cream. Well, we had to try 16 different bases before we found one that allowed the mannitol to penetrate through the skin and to reach the nerves.
Yes.
And so once I found that out, I tested it on 289 different pain conditions. Everything from migraine headaches to burning feet, to arthritis of the fingers or the knees or whatever. And the average pain relief was 50.8%. What I would do is, Marilyn, the pharmacist, was making the cream in her kitchen. She was mixing the mannitol with that base cream in her kitchen, and then she would give me these little containers of cream that I would give to my patients, and I'd give them a questionnaire, like
Right.
date, time, how bad is your pain before on 0 to 10, how bad is it 30 minutes later, how long did it take to work, how long did it last. So I've got this database for these 289 different pain
Patience. Yeah,
patients.
that's awesome.
And so the average pain relief was 50.8%. Okay, it wasn't 100%. But the average pain relief for narcotics is, do you know what it is?
I don't. I'm sure it's less than 50.8% though.
It's 36%.
Significantly less. Yeah.
You know what the average pain relief for anti-inflammatory medications, Advil, naproxen, ibuprofen?
Even less, maybe 25%.
You're very good.
Oh.
24%. And then the average pain relief for Tylenol?
Is less again. 19%.
13%.
Oh, 13. Wow.
So 50.8% is pretty good.
It's significant. It is very significant. And when you think of someone who's in a lot of pain, if you can reduce that pain by 50%, that's incredible.
Exactly.
And to know that the other products on the market are reducing it by less than that, I think every household needs to have your cream in their medicine cabinet.
And so it's called QR cream. Here, I'll show it to you.
Yeah, QR cream. Well, yeah. How do people get this?
Amazon.
Amazon has QR cream. And is that Amazon in Canada and US or everywhere?
Canada and the US.
Perfect. Well, I definitely will be getting some for my household because my husband has bone-on-bone knee pain that this might help
too. If your husband has bone-on-bone knee pain, he should go to my website because on my website, that's the website. It's
nopain.ca.
Yeah, no-pain.ca.
Yep.
If he goes to my website, he'll see that there's a webinar, a free webinar.
Mm-hmm.
And after the free webinar, you've got a choice of all kinds of different areas of pain that you can help. And he should get the one on how to make your own orthotics out of Kleenex and duct tape. Because you can actually straighten out your legs and get a lot less pain in the knees, because most knee pain comes when the knee isn't perfectly straight. And so if the legs are not perfectly straight, the ligaments on one side are overstretched and they will start complaining.
So that's where you need the orthotics in order to adjust that so
you can straighten out your legs.
Right.
And you can get that set of instructions very easily that way.
Well, beautiful. I was meant to meet you today, so I will definitely order some of the cream and direct my husband to that free webinar that you have on your website. And I'll just say the website again for anybody who's listening and didn't see you hold up the sign.
Oh, okay. I'll hold it up.
Yeah, no-pain.ca. So, yes. Beautiful. Thank you. So those are some amazing free gifts there that it sounds like you've got a whole library of free gifts for the audience. So I'll make sure to mention that in the show notes.
Actually, the how to make orthotics, that's a set of lectures that I gave to doctors from Africa and India.
Oh, beautiful.
And I'm charging $19 for that.
Right.
Shame on me.
Well, we appreciate you putting all of that work together, and I will definitely share it with my husband. So, Helene, I love to ask every single guest that comes on my show, what does "don't wait for your wake-up call" mean to you?
Well, the thing is that the most important thing is you have to realize what it is that you really want in life. I think if you want to wake up to anything that you want, most of all, Once you know what it is that you really, really want, then don't wait. Do it.
Yes.
Get to work on it, because that may be the most important thing you ever do. Like the most fun.
I love that. Beautiful words of wisdom. And thank you so much, Helene, for coming on the show today, for sharing your wisdom, sharing some really powerful tools with people, and letting them know that they don't have to rely on surgery, that there's other ways that we can support our body's healing journey. And when we understand that, we can make different choices. And I will put the link to your book in the chat as well. If you want to hold your book up one more time for those watching the
Sure.
episode, and I will read it out for those that are listening. The book is called Low Back Pain, 3 Steps to Relief in 2 Minutes. So check out that book if you struggle with low back pain. Share this episode with others in your life that you know struggle with low back pain. I know there's a lot of people out there. And reach out to Helene's resource library on her website for support. So thank you again for being here, Helene. Thank you to my audience for tuning in each and every week to get tools, tips, and tricks in healing your physical body, mental body, emotional body, spiritual body, and to living your best life. Your unconscious mind is powerful. It's the other 90% of your mind. And yet, you're not even taught about it at school. What if you could access the other 90%? It would be like driving the highway in 6th gear instead of 1st gear. That's what you're doing when you only know the tools of the conscious mind, the 10%. You're going through life in 1st gear. Are you ready to ramp up and go through life in 6th gear? Learn the powerful tools of your unconscious mind, healing trauma, clearing anxiety in minutes rather than weeks, months, and years? Join our next Meet Your Unconscious Mind workshop so that you can start to learn the power that you already hold within and the tools to access it. Look for the link to register in the show notes.